Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Chronic constipation. On chronic constipation, it's something that we don't talk about too often because it's not really considered a disease, but considered something that is a bother. And it's fairly common for people who are older than 50. And they talk about how common it is and how sometimes people don't know how to treat it, and the different treatments for constipation, and how some people actually take medications to prevent it. But they emphasize that the most common causes of it are insufficient fiber, insufficient water intake, and sometimes side effects of some medications, some antihypertensives and antidepressants. But they emphasize that there are really about 4 or 5 things you can do to help treat it. And if you have, for example, they consider constipation if you have no more than 2 or 3 bowel movements a week. So it's kind of expected you have a daily bowel movement, although one can argue that you should have 3 a day, and it should follow every meal. But if you have less than 3 bowel movements a week, it's what's considered constipation. And some of the ways to deal with it, which is no surprise to anybody, is to increase the fiber in your diet. Some people will take prunes, some people will take other things that they find that help them move the bowels. For example, for me, it's corn helps me move, but other people have different things that they eat that help them have movements. But fiber is the number one thing to do. Then, of course, drinking enough fluids. We talked about drinking enough fluids before, and we've had different statements about how much is enough, but around 2,000 cc's is about right. And then you should have an urge to move your bowels every time you eat. So 30 minutes after you eat, you ought to be ready to go to the bathroom. And then exercise is also a remedy for constipation. And it's thought that almost everybody has had some periods of constipation at some point in their lives. So what have been your experiences with constipation?
Well, I think all things being equal, women, women tend to have this problem more so than men. And the reason is after eating, we have what's called the gastrocolic reflex, as Dr. Callender pointed out. So you get the urge to evacuate very shortly after you eat, within 30 minutes or so. Women tend to resist that urge to defecate because they're very fastidious and they tend to want to be in the right place, using the right toilet, that kind of thing. And so they tend to hold that longer. And as a result, the colon gets longer. So you store more stool in the extended colon. And as you get older, that becomes a real problem. Men, on the other hand, tend not to be so fastidious. If they have to have the urge, they generally go to the bathroom wherever they are, if one is available. And that is something that is very important. Some of the remedies are, as Dr. Callender pointed out, increased fluid intake, fiber, and exercise, walking. Activity tends to mobilize the activity of the colon. It's called peristalsis, and that's increased as you move your body. So those are, of course, there are stool softeners, medications that you can get. Some people prefer the natural use of prunes. Some use mineral oil, but there are medications that your physician can prescribe for you to soften the stool. That's my
Yeah.
input.
Thank you very much. Any other comments?
I had a question. How long does it take once you eat for the food that you eat to come out?
It varies because I'd say within 12 to 24 hours. For example, the gastrocolic reflex that Dr. Ivy talked about isn't the food that you eat, but it's the food that's already there. So it takes about approximately about 12 hours. So what do you think, Lou? Any thoughts?
Yeah, I agree. That's about it normally. But then here again, if you respond to the gastrocolic reflex, you may begin to defecate at that point within 30 minutes or so.
Right.
But if you decide to hold it, and because if you eat 2 or 3 times a day, stool backs up. And the reason for the reflex is to make room for the waste that's coming down the line. So it tends to urge you to get rid of what's in there to make space. If you fail to do that, then the bowel just enlarges because you're storing the stool.
Some think that this is why later on in life some people have conditions like diverticulosis and diverticulitis. Whether that's true or not is another question. Also, over the counter, they have some laxatives that people take, Zocalox and lactulose is not over the counter, but there are a number of over the counter things that you can ask your pharmacist for that will help you if you need it, but it's more advisable to prevent it than to have it. Any other comments about constipation? I just brought it up because there was a good article in there about it. It's a common malady.
Dr.
Yes,
Callender, some medicines cause constipation. And
Yes.
so can you take other medicines to counter the medicines that cause?
Yeah, there are medications over the counter, and there are medications that you can get the doctor to prescribe for you. Yes.
What are some of those that cause constipation?
Antihypertensives, blood pressure medicine, antidepressant medicines are the commonest ones. Any opiates, any of the opiates, the pain medicines, and the ibuprofen as well. Anything that contains calcium and iron can also cause constipation.
Dr. Callender, I had my thyroid removed from thyroid cancer, and when they removed it, they damaged my calcium receptors, and so I have to take extra calcium every day, high amounts, and so that's the bane of my existence.
Yeah.
Is constipation. So I use suppositories just about every day because I used to have bowel movements twice a day, and I don't feel right if I don't have one every day. So that's what I do.
Okay.
Dr. Callender, what Dr. Ivy said, it was exactly right for me because tended to hold it, didn't drink enough water, and female being fastidious, and especially where I worked, to go to the bathroom, you had to have someone to watch your class, and it was always not feminine for a female to Men, like we talked last week, if you have to urinate, you just go ahead and do it then.
Yeah.
And when you gotta defecate, when a boy has to go, he goes. And girls, we tend to teach, well, I was taught you hold it and it's not polite to let out anything. Gas, until the proper thing. So females, we talk for femininity, we have to be very discreet. And there's no smells. Even if I go to a public bathroom, and I know I gotta defecate, and I make sure that nobody's around, and I make sure that nobody can see me when I walk out of there. If something happens to happen, so it just makes it so hard for a female, for me, to go to. So consequently, even growing up as a child, I always had that problem with constipation, and mama would give me enemas and everything. But I found out, later in life, walking, I would go, and drinking enough water, which I'm not in the habit of drinking enough water. But that is much better for my system than taking X-Lax, and it's much easier and doesn't gripe your stomach. But it's hard to go when you're not in the right bathroom, and make sure, even at home, I can remember, and Darryl can attest to that, when Daddy went, the whole house, no, but he didn't care. We open up all the windows, but a female, you're just not supposed to smell females. Anyway, I'm going on and on. But Dr. Ivy, you were so correct.
It's a great teaching opportunity to teach our daughters and granddaughters to let it go. Another comment about something that's particularly constipating, and that's sandwiches, particularly fast food sandwiches, because they're typically white bread. White bread can be very constipating. Whole wheat bread is less constipating, but still on the whole constipating. And red meat is very constipating food.
You know what? Women would not probably go to a gas station bathroom, but men might.
Right.
Unless you have to.
You gotta almost have diarrhea to go.
Yes.
If you don't have diarrhea, we just hold it till I get home. My bathroom, where nobody's around.
Elizabeth, you had a comment?
Yes. Again, good morning, everyone. Dr. Callender, what I've learned, first of all, the things that Kara talked about, I can totally contest to that, because that's what our mother taught us. And so my question, before I get into comments, my question is bloating associated with constipation, and it's large stomachs, other than the fat part, associated with constipation?
Bloating is not necessarily associated with constipation. It can be associated with all kinds of things, but constipation isn't necessarily, bloating isn't necessarily part of constipation. That's a separate issue, which is different.
Okay. Yes, as Kara was saying, my mother used to tell us quickly. She says, if you go to the bathroom and the smell comes to your nose, you're not doing something right. Come back to your nose. And also, my mother told us that if you ate sugar, if you ate an excess amount of sugar, it will come out back to your nose. And she could tell that you've been sneaking candy. My baby sister's always famous for that. I didn't have any problem. But I thank God that ever since I've been in this world, I've had the 3 bowel movements. And so, like Kara, what I do now, that since I have to go out and drive, I get up and do a large amount of water intake, okay? Because I don't want to do it outside the house, because I like clean things, okay? And so that's what I've learned to do. Now, as a teacher, I was thankful when I first started teaching, I had a bathroom right in my classroom, adjacent to the classroom. So it was a personal bathroom. I got lucky those first 2 years. But I totally agree. It's just very uncomfortable. So I've learned to work the schedule of my body so that my body can be comfortable wherever I have to go.
Well, thank you very much for those comments. I guess it's a topic that is rarely discussed, but it's something that is common to all of us. So I
Dr.
think
Calder,
worth it.
one question before you leave the topic. Sometimes you can tell by the size of the stool, I think, if you're constipated. If everything is going right, you have what I would call full stools. But if you're constipated, you're gonna have something that looks like little teeny balls or something. Is that correct?
There's a lot of variation on that theme. It depends upon how long you stay constipated. If you stay constipated for 3 or 4 days, you have so much stool that you may become impacted, and somebody will have to disimpact you. So it varies. It varies.
But those small balls are called skibbolus stool, and that tends to be associated with lack of water intake. So the stool is hard and breaks up in little pieces.
Thank you for that.
So we got a name for everything,
Dr. Callender, my understanding is that if you've had enough water and enough dark green leafy vegetables and all those things that you're supposed to eat, including that amount of fiber and everything to go along with your nutritional plan, my understanding is supposed to just slide out.
Well, that's true, but that isn't true for everybody because everybody has different neurological innervation of the GI tract. But the ideal thing, as you mentioned, is to have 3 bowel movements a day and for them to come out easily. But there are exceptions to the rule.
And one more comment, children and babies, they teach their mothers, but we don't learn from them. When they have a bowel movement, they just let it go. And I used to be amazed at how much could come out of a baby. And then had a granddaughter, we went to a hotel and she clogged up the whole thing. And it was just amazing how much could come out of one little kid. And then you got to call the plumber to unclog it because it couldn't all go down. But I guess that was normal. As adults, we don't tend to clog it up like little kids. They just let it out, But anyway.
Well, I had an exception to that because I had one of the doctors I work with who had the same problem that would occur after he went to the bathroom. And so they would call and complain about him because he always had bowel movements that would plug up the toilet bowl. So it ranges from person to person that people, but it's interesting that nature has its way. Any other comments?
This has been a very interesting topic so far.
Yeah, it has. Wouldn't have thought so. But it's very.
Everybody's got to go, so.
Let me just add one more comment. And I do agree with all the ladies and their comments about what their parents told them. My parent told me the same thing. I developed a phobia. And I could not go to the bathroom if I was not at home or if it was not a familiar place and if that place was not clean. And with my job years ago, back in the 70s, we traveled a lot throughout the United States, and I would be on the road for at least sometimes a couple of weeks. And it was very difficult for me to go to the bathroom. I did all the fiber, I did all of the things that you should do, the vegetables, but I could not go because I was in a very unfamiliar place. When I got back home, I had no problems. But because I was so impact, my tissues got torn and I started bleeding from the rectum. Well, my mother had to come in and she had to examine because she was a nurse. She had to examine my stool, so I was embarrassed again. And she immediately took some samples of the stools and we went off to the hospital. And that's when we sat down and talked. And they said that it was some type of a phobia. And it was something that I had to do to get over the phobia. And it was something, and it may be that I need to go see someone for additional help. But I had talks with myself when I went to the bathroom, and eventually I got over the phobia. I'm good now. I go 1 or 2 times per day, but it was quite an experience to have that phobia and to overcome that phobia.
That, it's interesting because what you brought out brings up another thing that they talked about that not heard mentioned before, which we kind of take for granted. And that is that having social interactions and friendships are just as important as having exercise and eating the right foods. And so having somebody you can talk to is so important. Anyway, I thought that was.
Dr. Callender, one last comment. It's amazing that women live so long. So much is put upon us coming from bowel movements, our hair relaxers, putting poison on our lips, wearing high heels that throw our backbones out of joint, putting on fingernail polish. We do all sorts of things for our beauty, for being a feminine female, and yet we still outlive you males.
Moving on, John Buchanan.
Well, you know about
that requires no response.
You know about the XY chromosome.
Dr. Callender, one last comment. One of the most difficult things that I think I've encountered is taking when my grandgirls were little, having to take them to a public restroom. Because there I am holding the child up saying, let it go. But I found out that my daughter rescued me. There are small little packages that they sell that when you take your young kids to the bathroom, they have cleaning, a little kit where you can sort of spray and clean up the bathroom before the child uses it, including a more secure toilet seat. So they've improved it since we were kids.
Well, you know, there's one thing that you ought to remember is that women are genetically stronger than men because they're what they call double X chromosome makeup. Men are XY, so we're sort of weaker because we're not as built that way. So you are built that way for a purpose. The many tasks that you take part in and all the things that are expected of you, women are built stronger.
This article is an example of women living long, isn't it?
Well, this is interesting because this world's oldest known person is a woman.
That's what I'm saying.
Yeah, and she died at 118. We 16 days shy of her 119th birthday. Wow. Which is interesting. I think of people who live to be 90 is something, and here you have somebody almost living to be 119 years old. Wow, that's interesting. You wonder what kind of lifestyle she had at the age of 115.
Well, Dr. Callender, my mother's name is Lucia, so is this lady, and she is 96. So my brother keeps saying she's gonna live a long time. Each year we're saying 5, 10 more years. And we've seen it from 85 to now. We said, oh my goodness.
Well, there's a 122.
We're so thankful though.
Well, a recent study was released saying that genetics plays a big role in how long you live. It's not the only thing, but it's one of the key factors. And people who live longer, their progeny tends to live longer. My mother was 97 when she died.
This is interesting. Super centenarian. Those are people who reach the age of 110. uh, that's amazing. Yeah. Hmm.
And of course, there's a racial component too.
Hmm. Well, the only thing that is certain in life is death. So some would argue taxes are certain too, but if you're rich, I don't know about that. They pay so few taxes. We know for most people it's death and taxes, but for everyone it's death. This is an article that one of the things you've heard about Ponce de Leon and his search for the fountain of youth. And of course, he didn't find it, but we're now identifying treatments that actually cause the cells, the telomeres that are associated with long living to remain long. And the ultrasound treatments, which they talk about in this article, as well as other medications that are now capable of causing the mitochondria and the telomeres to stay long and allow for rejuvenation. Now, whether this is going to work, this has been done with animals. Question is whether this new sound therapy will be effective in humans. And so we shall see. They've done research on cells, but not actually with humans yet. Do you want to live longer? That depends on what your lifestyle is as you age. And also it depends on what kind of celebration you have as you age. If you find some people at 95 who are mentally alert and some people who aren't. So any comments on this? Okay. This is an interesting article that talks about the fact that people of different ethnicities die from different cancers. And this study looks at what cancers affecting Black people, what cancer affecting Asians and others. And so you can go down the line to see that we die from breast cancer, uterine cancer, and of course for men, we die from prostate cancer. You see that 2 to 4 times higher than those in every other racial and ethnic group. And women, Black women, more often die from breast cancer and uterine cancer. And you had a plethora of the field of surgery of women dying from breast cancer. It's frightening. But the disparities indicate that highest mortality rate for both sexes among Native Americans, with the Blacks coming in a close second. This is what is frightening about the prostate cancer mortality, that for the same types of cancer, Black men die more often than white men. And I think it was mentioned a couple of meetings ago that sometimes white doctors don't recognize that Black men have more often have prostate cancer, and it occurs earlier and more aggressively. And therefore it becomes cancer screening is more important for Black men. And so having digital rectal exams and PSA examinations after the age of 45 becomes important. And sometimes white doctors aren't aware of this. And as such, they don't get PSAs in Black men. I think that's a mistake that we need to rectify. And the same thing with the mammograms. We need to have those earlier than white women. Because the breast cancer that our women develop is associated with much higher mortality. breast cancer and uterine cancer in women is something that's, look at the difference between survival of white women and black women. Suggesting that the screening is something that needs to be done more. And any comment about this? Because this is important. The screening program is important. Everybody getting their mammograms when they're supposed to. Black men getting your PSAs and digital rectal examinations. One of the things that we don't get as much is skin cancer, although we get malignant melanoma and stuff. And this points out that during the pandemic, people stopped getting screening. And of course, that in the long run, it's going to wind up in having more cancer deaths.
Dr. Callender, is tamsulosin and medicine to stave off prostate cancer for men?
I didn't understand what's the question?
There's a medicine called tamsulosin. Tamsulosin, and is that for prostate cancer prevention?
No. Tamsulosin is for to increase your ability to urinate, but it does not have anything to do with cancer, with prostate cancer. It's for prostatic hypertrophy. When you have prostatic hypertrophy, you get up at night and urinate more. And so tamsulosin is used for benign prostatic hypertrophy, but not for prostatic cancer.
Thank you.
Okay, go to the next one unless there's any comment about this. This article talks about some of the risks associated with racial and ethnic diversities. And as we go down this article, you see that genetic information is used to try to identify the likelihood of developing some of these diseases in different ethnic backgrounds. I always smile at the term of racial and ethnic backgrounds because there's only one race, that's Homo sapiens. We're different ethnic groups, not different races, we're all Homo sapiens. But traditionally, that's the term that people use, inaccurate though it may be. And we are finding out that genetic backgrounds play a major role in terms of many things, especially where you live and how you got to where you live, how people have moved over centuries from different parts of the world, and as a consequence have had developed different disease entities. And I think that as we know that Africa is the birthplace of humanity, that as you get farther away from Africa, a lot of different genetic findings. Dr. Attal, you want to say anything about that? That's your area of specialty. Okay.
Dr. Ivy, you muted, I think.
Okay. Constant Farmer's Lasting Connection. It's an interesting article.
Oh, yeah.
I'm not sure what, John, what is this about? I'm not sure.
Yeah, he received a transplant from a donor, and I think it was a tissue. It wasn't a organ transplant, but he received a tissue donation that enabled him to get back to playing football. Happened during a game. He tore his ACL. You hear about that a lot from athletes, and I just thought I included it because he was a recipient.
One of the things that people tend not to understand is how important these tissue transplants are for athletes. And this is an article is a good example of it, because many of the athletes come back and recover very quickly because they do have tissues that are given to them that allow them to recover more quickly than ever before. And so so that you can donate organs and tissues after death. More often than not, we talk about life-saving organs, but life-saving, quality-enhancing tissues that allow you to recover from athletic injuries faster than ever before. Certainly the organs save lives, but often the tissue donations improve the lives of more than 50 people from one donor. So it's important not only to know about organ donation, but also about tissue donation. The difference between organ donation and tissue donation is that for organ donation, you need to get the organs within 60 minutes of cessation of the heartbeat. Whereas for tissue donation, you can get the tissues within 24 hours of death.
And this article mentioned that some tissues can be stored for years.
Well, yes, that's correct, because they put it in, they freeze it, and right. So you consider being an organ or tissue donor, and I think that's, and you see people having Achilles tendons torn and all this, and these cartilages, ligaments, and other tissues can be used to help somebody else. So that's an important story. Okay.
All right.
Any questions about that? One of the 7 types of tissues that can be donated is actually more than 7 types, but they often don't talk about the corneas, which of course give sight to the blind, tendons, of course, which allow you to heal quickly, heart valves, which come from humans and others, veins, skin, musculoskeletal tissues, and nerves. All of those can be actually donated.
Dr. Callender, isn't blood a tissue? It's a fluid tissue.
The difference is that blood is given in life. These are what they talk about giving after death. So that blood is given as a live donation, whereas the others are given after death. Blood is one of the commonest tissues that is used and is very life-saving and different from most of these tissues, which are not life-saving. Blood is life-saving. These tissues are quality enhancing, but actually are not as life-saving as blood and other organs. So it's in a different category. So I think it's very valuable to consider the topic that you added of tissue donation, which we sometimes forget about. This is an interesting concept about the University of Idaho murders. And they call this incel complex, which related to the fact that these people are involuntarily celibate. So they are unable to have romantic and sexual interactions. And so they believe this is why some people kill people. And they wonder if this person who did this fits into this category. Hadn't heard it before, so I thought it might be nice to just introduce this to you as a concept. Whether this applies to this particular person or not, we don't know, but it's also being aware of this incel complex. Any comment about why people want to kill each other? This is just one of the reasons. We see so many killings these days. It's kind of frightening. People kill for one reason or no reason. They just kill.
That was particularly related to men killing women.
Yeah, right. Working moms are, that was interesting. One of the things that we've observed with transplantation is that women are more likely to be donors and less likely to be recipients. And one of the reasons
needs to be shifted
one of the reasons is
to the right.
one of the reasons we think that is the case is because they often do the brunt of the work at home and are taking care of the children. And sometimes the fathers are absent, and so mom winds up doing everything.
Left side of the screen is cut off a little bit, John. You can.
And so I don't know if any of you women want to make any comment about this, but working moms is kind of common these days. Used to not be so, but nowadays mom and dad are working. And sometimes this has an impact upon the children. How do you feel when you're working like that? And you moms who do this, do you feel like you short-shifted your children? In the old days, it used to be that the father would work and the mom would take care of the children. That's not often the case anymore. What are your thoughts about that? Especially from the female perspective. Any of you moms want to make any comment?
It will only work if you have a partnership. Raising kids and working back in the old days, moms didn't work. And I know that's how it was when we were growing up. My mother didn't work, and my father would work 1, 2, sometimes 3 jobs. But we also felt that dad was the good one because he wouldn't spank us. And my mother, oh yeah, she would kill us. But nowadays it takes 2, and there are 2 working in the household. And it's about, it's a partnership. You set schedules. And that's the only way it works. Sometimes the schedule is a little off kilter, but you just take up the slack. And the main thing is putting the kids first and their schoolwork first and their daily routines first. It's a lot raising kids nowadays, because at one time you go to school and you came home, but nowadays kids have so much going on, and it takes, both parents sometimes to fill in the gaps and keep everything going as far as keeping the kids engaged.
You said moms didn't work. You meant moms didn't work.
Moms
out of the
didn't work
house.
outside the home, working in
Because
the home.
moms
That's a
have
big
always
job.
been working.
It was
Yes.
8 of us. It was 8 of us.
But
So
mom had her hands
maybe
full.
with my father working those 1, 2, and 3 jobs, maybe that was relaxing compared to being home with 8 kids running around.
I think
But,
you're right. I
yeah,
agree with you. I think
Yeah.
Dad was better off. He had
Yeah.
an easier job.
yeah.
My mother didn't work and there was just 2 of us, but that was her choice and my father. And she did all the care raising. But then I was raised like that. So consequently, when I had children and taking them to the doctor and etc., that's what I just figured was my role. And I took them to the doctor and everything. And I think I heard Dr. Callender said the same thing, you did what was comfortable for you in your role. And he left it to his wife, and he didn't get so much involved in it. My husband and I, we were sort of the same, because both of our mothers stayed at home. So we were sort of raised in that role, and I did that role. But one time when I took the children to a pediatrician, and she was also married to a doctor, and she was just saying, and she looked at another father who was bringing their kids to the pediatrician to get their checkup. She said, how does that work? I'm doing it all and you're doing it all. But then the younger generation, or somebody was in our generation, the fathers are stepping in, bringing the children to the pediatrician. And I'm noticing that my sons, they're doing what I used to do, and with their wives, they had working mothers, so they divide everything half and half. But I sort of did it different. But I do notice this younger generation, not mine, maybe Janice, you're in my generation, but
Yes.
there's some people, not like John and Dr. Callender, but there's some, the women, we just did it. We took care of our children, and the men still worked as our fathers did.
I was going to piggyback off what you just said. Like with my husband and I we divided the duties. So he took the kids to the doctor, or I remember my grandmother say, "Oh, you letting your husband take the kids outside?" I'm like, he learning just like I did. I didn't know much about babies. He didn't know much about babies either. So we learned together. What I'm blessed about is he wanted to do it as well. So, sometimes you have people who don't necessarily or feel like roles are specifically for women or roles are specifically for men. So what's good for me is that my husband actually wanted to do it as well. So, but it is hard. I came back to work from maternity leave like a week early. I was like, get me out of this house. I say, we just have like it.
Yes, Dr. Callender, I totally agree with all the ladies. I totally agree. But right before we start discussing that, remember, Dr. Callender, Dr. Ivy said that women were built stronger. Well, now we know. But
well, that's Dr. Ivy's opinion, not mine necessarily.
Yes.
Well, that's the physiologic.
Well, we don't need to have that debate, but because they have 2 X's doesn't necessarily mean that.
Well, I know we have 5 children, and my wife has been caring for them as long as they were growing up. And I was working outside of the house, and she was working more than 8 hours per day in the house. But after the kids were no longer underfoot, then she began working with me. And I think today the men and women are sharing both loads, and that's more reasonable. But in the olden days, the women's job was in the house, but she was working harder, at least as hard as the men were outside.
Yeah, that's for sure. And they would get very upset when somebody would say to them, as you responded to, that they didn't work. When
Right.
in fact,
Oh, yeah. It was 24 hours.
Yeah.
right,
As the kid says, 24/7, right?
Right.
That's what they say
Right.
now, 7. But, you know, also, again, I too, like the ladies, what made it work for us was my mother was a no-nonsense mother. And my father was a no-nonsense father. The teacher didn't, you know, like when we taught school, we had to tell the kid maybe 3 times to do something. My mother said, I tell you once and that's it. Okay. And so that's the way. So we didn't have any problem listening in school because we were well trained at home.
And that's
so-
true. And that's what I'm saying. I made a mistake by saying my mother didn't work. Oh, she worked very hard.
Yeah.
Like I said, it was 8 of us with 8 different personalities. And
Yes.
plus, on top of that, she kept a very clean house. She
Very
taught us
clean.
how to clean.
Yes.
Very clean, very clean. And
And-
we didn't have to worry about stepping outside the line because when company came in, my mother had a way of giving you the eye. And if you caught that eye, that means leave the room and go to your room. Otherwise, after company, she'll pull out that flip-flop and she'll beat you. I don't mean spank, she'll beat you. So yeah, we were very mannerly. We were taught to be very clean. We did our schoolwork. When daddy came home, we were happy. Oh boy, daddy's here.
Well, you know, there's a lot to be said to the scripture that says, train up a child. And that's what they did. They train up a child so that they follow every letter to the law of training up a child. And even though my mother too was the strong one that handled all the responsibility, told him, because my father was working outside, was the fact that he was her backup. Whatever she said, if you had any inkling of thinking, like my brother, of course, of thinking of not doing it, there was my father to back her up. But I totally agree. Kids came first. And my mother, that's what my mother said when I left off going to college, going back to the college situation. My mother says, when you go to college and when you go away, remember, enjoy your life. Because when you get a kid now, that kid's gonna come first. And so I learned that this generation, which is my kids and your kids, they're sharing responsibility. My son is cooking and doing things I never thought I would see him do. And in fact, some of the young men can do it better than some of the young ladies now.
Yeah, that's right.
And so my son don't hesitate to do things. But one thing I am thankful for is, like they said, partnership, teamwork, and family team. That's what makes it successful today. Okay. And so family support. Now, because we're called baby boomers and sandwich generation, all that kind of stuff. Not only are we giving support to our kids, but we're giving support to our parents. And so now it's family support is so important.
You know, it's interesting that people don't understand until they have children that you're a parent for life. And that you take care of your children as long as they live, and then you also take care of your parents. So it's an interesting way of living to appreciate all of the variety of things that you do as you grow. But sometimes the younger people don't recognize that you're a parent for life. So just because your children get older doesn't mean that you change your responsibility, because when your child who is now 40 needs help, you still provide, regardless of the age.
You got that right.
Yeah. This is an interesting article on, I appreciate the fact all of this discussion, because this is how we learn about many things that aren't written about. And discussion is so helpful to what we're doing. This is about skin, which is the largest organ in the body. Sometimes we take it for granted because it's the barrier to everything that's outside. And of course, when we talk about skin, we think mostly about women and the creams they use to keep their faces and bodies looking good, and forgetting about the fact that the skin is the structure that keeps you alive, keeps you healthy, keep you from getting infected. And that if the skin peels and foliates, which is the term we use, then you're going to be in big trouble. And so using the right medication, skin creams, become something that's important. People who have dermatitis, eczema, and those kinds of things appreciate it far more than people who take it for granted that their skin is going to be okay. And that's why dermatologists thrive, because it's hard to get an appointment to see a dermatologist these days, because there's so many people who have skin issues. And of course, this then is a $1 billion industry. Any comments about this from you women who use these creams? Men don't use those face creams, as far as I know. But
it may not be face creams, Doc, but if I don't put that lotion on my legs, oh man, I'm in trouble. I'm in serious trouble.
Dr. Callender, my question is, eczema and dermatitis, and psoriasis, those skin conditions, very common. And so when you go to a dermatologist, the prescriptions are always the same for those top 3 skin issues. So, you go to the dermatologist, they give you one of those creams, prevent one of those 3 things, and then you go home.
And your comment is what? What is your comment? Is that a question or a comment?
The question is, why are they so popular when there are only 2 or 3 remedies?
2 or 3 what?
Remedies.
Remedies. Oh, well, the skin is the most important organ you got. And if you start itching or you start having lumps and bumps, things in your skin, you want that to be taken care of. We all know that skin cancers loom large, and of course these other conditions are much more common. The acne and the psoriasis and the other skin conditions are a lot more common. Then of course there's the skin. When the sun is out and you get burned, you get burned. So that it's just that the skin is such an important barrier, and it protects you so much that if you get any trouble with it, then you want to take care of it as quickly and as promptly as possible. And I think that's why dermatology is, that's why it's so hard to get an appointment to see a dermatologist.
Dr. Callender, I wanted to inject a little thought here about the sunscreen. As a scuba diver, we found out that some of those sunscreens that we used to use were very harmful to the coral. They actually kill the coral. So moving forward, I just want to put this thought in people's minds to get sunscreen, which is very important now, especially if you're out on the water fishing or swimming or anything like that, to check to make sure that your sunscreen is safe for the coral.
Any other comment about the skins? And I guess, how many of you men actually go to dermatologists?
I do.
I have to.
Me too.
Oh,
Yes, only for pigmented lesions, things like that. You want to check out, make sure it's not cancer. That's particularly one of the instances where men and everyone else should frequently attend a dermatologist. But
And as you age, you get these skin lesions that are related to aging.
yeah,
And in order to know whether they're malignant or not, you go to the dermatologist, get them.
I see one once a year because of that, age, spots, moles. I get concerned. He checks it every year, says it's fine, and then he compared it just so I can have a visual. He said it's like Morgan Freeman and the spots on his face or the moles on his face. He said it's nothing to be concerned about, but every year I go and he checks them out and give me a passing grade. So yeah, I think age sometimes it has a lot to do with it because we do get these age spots, and sometimes we can take for granted it's nothing, and it could be something totally serious. And I do have moles.
Yeah, I have one of our surgeons who went to the hairdresser and they found a mole which turned out to be malignant melanoma and actually wound up killing her. So that
Wow.
yeah, so skin conditions are important, and going to the dermatologist is something that you need to do.
Are
okay, I got a
are
serious.
nails included in that? Your fingernails?
I'm sorry.
Are fingernails and toenails included?
Included in what? In dermatology?
Yes.
I don't know because I know for the toenails, I think the podiatrist, for the most part, will take care of that. For the fingernails, I'm not sure. But definitely for the toenails, the podiatrist will take care of that. And that's important, especially if you have any conditions like diabetes or anything like that. But this, the nails of the hand probably often are not addressed, and they need to be sometimes.
Dr. Callender, I noticed talking about hair, skin, and nails. I noticed that the common ingredient in high quality supplements is biotin.
Mhm.
I have a question about a couple of questions. What causes ashiness, and is it only here in America that we are concerned about ashy legs? In other continents where our culture is, are they equally concerned, or do they have that problem?
I don't know. I don't know. I don't know the answer to that question. In terms of ashy legs, I know we talked about it. I never really considered that as a medical problem, but I don't know. Dr. Ivy, you have any thoughts about that?
well, most dermatologists think that it's due to a lack of fluid intake of water, but we all exfoliate, and if the skin is dry, it may appear to be ashy or flaky like dandruff. That's another aspect of that. But I think ashy is not a medical term.
Right.
We don't use that. But I understand if you just, after taking a shower or a bath and your skin is reasonably moist, if you put some sealant over, some skin cream to keep the moisture within the skin, you will have less likely problem with ashiness.
Yeah.
And then the other question, it came up on this discussion about petroleum jelly. That was said that to be bad for you and not to put it on your skin.
Well, I think that's correct, because it doesn't, the petroleum jelly seals the skin and doesn't allow it to breathe. So our temperature control is reflected in our skin. So we have moisture escaping from our skin, and Vaseline those kinds of sealants prevent the escape of fluid and moisture from the skin. So it's detrimental, more so than helpful.
And then one last thing, and I'm looking at the men and women that are on this panel. Men are not putting on makeup or anything like that on their skin, yet their skin look just as healthy as the women who put all this makeup on. Any comments about that?
Yeah, not exactly true. Men that shave are using shave creams, and shave creams are notorious for containing petroleum jelly, which makes the razor glide over the skin easier. And it's not just, yes, petroleum jelly sealing in the skins. That is one problem. It also increases estrogen problems in the body, which can damage the endocrine system. So, yeah, petroleum. Most makeups are not regulated by the no cosmetics are regulated by the FDA. So the stuff that you buy is the only check and balance for it is how many lawsuits they get. But then they have to prove that the product actually caused the health products, and so it's a little different because I mean it's it's hard to hold cosmetic companies accountable for their faulty products because they're not researched by the FDA before they're put on the market.
And sometimes less is best. We tend to put a lot on our skin, especially face. I'll speak for myself. Different soaps and creams on your face. And then I started having a problem with dryness of the skin of my face. And I stopped using soap on my face for a while. And you don't always need to do it. I don't wear makeup. So it's not a matter of needing the soap to wash away the makeup. And water can be just as good. Use less chemicals, less soap. I'm not saying give it up totally, but twice a day, 3 times a day, which is what I was doing, I found that it was too much, and just use the water.
I agree.
We had a dermatologist on the group session, I think within the last couple of years, that one of the skin moisturizers they recommended was shea butter.
One of the things you mentioned, shaving creams. The difference though is that with the shaving creams, you put that on, you shave, and then you wash it off so that it doesn't stay on like some of the other creams. In other words, they stay, whereas with the shaving cream, you wash that off after you shave.
And the men are growing beards more now, so they don't shave to the extent that they used to.
Right, it's amazing. Yeah.
I like to look at the skin as an organ that anything you put on your skin for the time that it's on your skin, you're drinking it because it absorbs. So yeah, shave cream isn't on your skin that long, but anything that's toxic, I don't want it on anytime because of the possible absorption of toxic material.
Okay. Any other thoughts on the matter? This is an article I put in here because I thought it was food for thought. Sometimes we we think of the physician as the treater of disease entities, but forget that the physician is the person also, and is impacted by who he's treating and who he or she is treating, and that surgeon or physician can be a victim. And this story just talks about a doctor who took care of patients, but at the end of the day, after taking care of a lot of patients with the COVID situation, and that we know a lot about that, actually driving home from work after a while, she considered driving a car off an overpass, which is suicidal. And sometimes people don't recognize that doctors are human too, and they sometimes are impacted negatively by all of the work that they may do, particularly if they don't get rest. So recognizing that post-traumatic stress situations occur to the treaters as well as those who are treated, and that this person can be a victim is something that I thought we should take into consideration. We talk about post-traumatic stress disorder with the military. We rarely think about it with physicians. In point of fact, if you lose a lot of patients, particularly like if you're in a field in which the mortality rate is high, then this can cause you so much distress. And if you don't recognize that your role as a physician is to do the very best you can, and that you don't have the power over life and death, then that can cause you to have PTSD. And this then can result in suicidal ideations and depression and other such things. So recognizing the physician as a second victim is an important consideration that I think we sometimes don't think too much about. Any comments about this?
Yes, I know as a surgeon, when I was younger in my early residency, I really wanted to be a pediatric surgeon. And I was, my program stationed me out in Phoenix, Arizona, the Indian Hospital for a year. And I worked with a pediatric surgeon at the Crippled Children's Hospital, who happened to have been the president of the American Medical Association. His name was Dan Cloud. And I asked him about going into pediatric surgery. And he said, well, first, you really need to take a cardiac surgical residency because that's the way of the future in pediatric surgery. So that's how come me to go into cardiac surgery. But on the other hand, I was very empathetic with children, and I found it very difficult for me to treat sick babies and sick children. It was just too much for me. I could not handle it. So it was a good thing that I switched over to cardiac.
That was the main reason I didn't go into pediatrics as well. I didn't like the idea of that either, because children get well quick, but they also die quickly. And so I never seriously considered that because of that. Any other comments about this, the physician as a victim, second victim, and PTSD for doctors?
Dr. Callender, do the patients of these doctors, should they be empathetic and be concerned?
I don't think so. I think they have saved the lives of the patient. So the patients are not the issue. It's the devastating impact of those patients who they have been unable to save, which are the problem. And as you lose patients, if you forget who's in charge of life and death, and you lose an inordinate number of patients, it can have a negative effect upon your mentation.
So do you look for your colleagues to help you out in that area?
I don't. I look to the Lord to help me out. But there are those who may want to get mental help through a psychiatrist or consolation. But I think one of the important things, when I started in transplant, the mortality rate was 50%. So many patients died. And so as I evolved, I learned to recognize that what was important as a physician is that you do the very best you can every chance you can, every opportunity, and learn from every mistake you make and don't repeat them. And that helped me a lot in terms of addressing dealing with the negative impact of what happened with the patients that I was trying to save. Any thoughts, Dr. Ivy or others? Any thoughts about?
Well, I agree. I think the thing that's really significant is consistently surgeons tend not to operate on their own family members. And that's because of the empathy and the probable understanding that you cannot be dispassionate in treating them. So your emotion affects your work. And as long as you're in a situation where you know that you're going to be emotionally affected, you cannot be dispassionate in the case, then you avoid that interaction because you cannot give your best. And as long as you can be objective with the patient, and as Dr. Callender said, you do the best you can as often as you can, as long as you can, that's the best that you can do. You can pray that God is controlling your hand or helping you along the way, but it has to come from you and how you react to the situation.
And if you make a mistake during surgery as a surgeon, do you admit the fact that you made an honest mistake, or do you try to cover it up because of fear of repercussions?
You should admit, it is ethical for you to admit that you made a mistake and not repeat it. So I think it's an important part of your ethic requirement to admit that you've made a mistake when you make a mistake. Everybody makes mistakes.
Yes.
So what is important about mistakes is learning from them and not repeating them. And but it begins with honesty and integrity and you admitting that you've made a mistake. And that's an important aspect of being a physician.
And another aspect with regard to that same question is that we as surgeons depend on the use of a hospital to practice our specialties. And as a result, we establish programs wherein we discuss all the errors that we've made, what we call morbidity and mortality conference. So we try to learn from our mistakes. We don't hide them, but we try to learn from them and not repeat them, as Dr. Callender said, and enable us to learn and do better as we progress.
Doctor, you know, we've seen some articles in this group session. One that I can remember is the nurse who injected the wrong medicine. The person died and she was punished. That's one issue. The other issue is malpractice insurance comes to play when doctors make mistakes, and lawyers, you know, they try to make money off of those errors. What is your thought on malpractice insurance increasing as time goes on?
It's a matter of fact that it exists and it's gonna get worse, but there are states that now limit liability, and that probably is going to become the rule rather than the exception. But it's a fact of life that that doctors make mistakes, as all humans do, and admitting the mistake and learning from it is an important part of the process, as Dr. Ivy mentioned. But that does not mean that you won't have malpractice premiums to pay, and they are the kind of the bane of our existence. But they are with us whether we like it or not.
Another thing is you as a personal driver just driving along the highway may encounter an accident where someone is seriously injured, lying on the ground or whatever, and or you're on an airplane and someone gets sick and they ask, is there a doctor aboard? Well, many states, New York in particular, where I trained, at one time did not allow a doctor to render first aid. You can only render professional care. We just don't render first aid. So doctors would tend to avoid assisting those in need of help, emergency help, because they know that they, under that circumstance, were liable to be sued. And the cost was not worth it, at least in terms of daily procedures or operations or whatever your profession is, particularly surgeons. So that has changed. New York has well, I think state US wide, there is a provision in the law that says emergency care can be given by doctors and not be held for malpractice. And so things have changed to a greater degree, but malpractice insurance as a private practitioner is exorbitant. And you look at OBGYN, so many OBGYN doctors have stopped delivering babies because all mothers expect to have a perfect baby when they're delivered. So that won't happen. So it affects the delivery of medical care to a major degree. And it's something that really needs to be looked at again and made more reasonable.
I'm reading an article on the internet from Politics of Healthcare. It's from 2017. And it says, an alarming new study says that most doctors would try to obscure their role in a mistake, and most wouldn't even apologize.
Mhm.
Well, ethically, that's inappropriate.
Yes.
I didn't say that your article isn't accurate. I'm just saying that's ethically inappropriate.
Yes.
And we try not to do that in the presence of a hospital setting where we do have conferences to discuss these very issues. So those who do not participate in that kind of thing or don't agree with it may do the reverse, may do what's unethical. But as a rule, most qualified surgeons will practice an ethical practice, let's say.
Yeah, I think that is one of the reasons why many people are scared of surgery. And
what is the reason?
Yeah, because when doctors make mistakes, sometimes they try to cover it up, because of fear of repercussions, either from insurance or otherwise. Many people, are scared to, from my own observation, although they try to get second opinions, and the second opinions may or may not support surgery, but they are scared, very, very scared to go for surgery.
John, what is this article about? I don't, could you go to the top? You can. Oh, this is the same article. Okay. Well, I think we've discussed this enough. So are there any other comments about it?
Dr. Callender?
Yes.
Is there a rating where they rate doctors whether they're ethical or not ethical?
No, because if they're unethical, they lose, they get kicked out of they lose their privileges.
Oh, okay.
And you have medical boards in every city. And if a complaint is made and brought to the board, and on this board, there are people who are patients and other people, so that it's not only doctors, and doctors who are found to carry out unethical practices lose their licenses.
And there are such things as standards of care, which are considered to be the minimum degree of care that a physician renders, whether it's general medicine or surgery or whatever. But there is a standard of care that's accepted by the American Medical Association and the American College of Surgeons.
Okay. Any other comments? Now let's go to the next one. This is an article on the 7 most common types of yoga and we've talked about different positions of yoga, which is one of the important exercises that allows you to have mental as well as physical experiences. And that all of the evidence is that this is a healthy practice, and most physicians would recommend it. And this talks about the different types of yoga and the way in which they are beneficial. We had talked about it last week, and this is an article that talks about the different types of yoga that is available. In most of the yoga, the breathing is one of the important aspects of the yoga, in addition to the other physical exercises. Any comments? Now we have a National Institute of Health that has a branch that deals particularly with so-called aspects of alternative medicine practices in which yoga is followed. And just about all of the research identified yoga to be beneficial.
One thing I wanted to mention is that in this article, if you're interested, those highlighted, underlined texts are links that you can click on to find out more information.
Okay, let's go to the next one. This is an article that talks about the exercises that are good for bone health. We talked about osteoporosis, in which the bones are soft, and bone density examinations that are able to identify whether your bones are soft or not, and whether you need to be on calcium and vitamin D supplement or not. And also talked about the hormones that are necessary to prevent this. And what we hadn't talked about particularly was exercises that will actually increase your bone densities. And I think it's a little question about the calcium and vitamin D, but later on in this article, if you scroll down, you see that there are exercises that they recommend. And there are, for example, here they talk about jumping and other things aren't recommended because they increase the risk of fracture. And some of the yoga positions can cause fractures of the vertebrae. And weight-bearing aerobic training is recommended, of course, and non-weight-bearing swimming, which is John Buchanan's favorite, is recommended. And weight-bearing aerobic training, and so I think it's good to know those exercises that are desirable. If you scroll back up to that again, walking, low impact aerobes, stair climbing, non-weight bearing, swimming and cycling don't contribute to improving bone densities. But the weight bearing aerobic training does. Getting your muscle strength helps as well. Activities that build muscle strength, resistance training That's good as well. Squats, lunges, and good extension. So building up your muscles helps to support the bones. Any comments or questions about that? Because I think osteoporosis is something that as we age, and they say particularly in older women, because of the lack of estrogen, that bone density decreases. And we have a bone densitometer, which can identify whether or not you have osteoporosis or not, which requires treatment.
My question, Dr. Callender, right there where it says improving hand-eye coordination, foot-eye coordination, doesn't some of that have to do with your brain?
Yeah. Yes. Yes, it does. But what is your point? Yeah, it does.
That's also part of yoga, also balance.
Yes, of course. Yeah.
Yeah, I guess my point is that sometimes you might see a doctor about your nerves.
Okay.
One question is, so do you take calcium to improve the bone density
Yes, calcium and vitamin D.
and vitamin D?
Okay,
That's
maybe.
another, that's another factor with regard to women having less bone density as they grow older, particularly those who have had children. With pregnancy, sometimes the baby takes the calcium from the female's bones, and as a result, unless she supplements her diet with calcium, she may progressively become less bone dense. And in addition to the absence of estrogen as she grows older, those factors contribute to that.
This will be the last article, but I thought this is something that we see every day, drugs advertised on TV. It used to be a time that wasn't the case. Now you can't see a commercial without seeing drugs. And one would think that those that are on the TV are the ones that you should use, but that isn't necessarily the case. And this points out that, however, those that were advertised were ones that made the most money, but that they weren't necessarily the best drugs. But can you imagine spending commercials top $22 billion? Wow. Now, why would anybody spend that amount of money? Because it works. And people see it on television and they buy it and they think it's the best. So, but this is
Well, that's true. That's
This-
true. In many instances, patients come into the office asking for a certain medication. And rather than ask the doctor, are you familiar with this? Or what do you think of this? But they come in with a preordained desire to get this medicine. But that goes with advertising and money making. And that's why they are so successful.
Right.
The commercial says, ask your doctor for this medication.
That's what it says. That's what it says. Yeah. And they do that.
Yeah,
Okay,
you know what? The other thing that gets me is that when they advertise some of these medicines, like the ones for, when you see two men kissing on the TV and they're advertising some kind of a medicine. See, when you go to your regular physician, you don't see that kind of stuff on his wall.
Okay, it's
Well,
10:30.
these are usually with HIV patients.
Yeah.
That's what, yeah. Okay, sorry.
I was gonna say it's 10:30, so I think that would be the last one. So let's close up.